of the land we are meeting on today and pay my respects to their elders past and present. I extend that respect to Aboriginal and Torres Strait Islanders people joining us here today. So Empower Healthcare, I'll just speak briefly about a little bit about what we do. So we are an allied health care provider, and we provide a wide range of different allied health services. This presentation will predominantly focus on how occupational therapists can support and provide support within palliative care. But towards the end of the presentation, I'll also briefly go through how other healthcare professionals can also provide support to people within palliative care. Okay, perfect. So this presentation, I'll just do a bit of an introduction. I'll go through what palliative care is. I'll speak about what an occupational therapist's role is within palliative care. I'll go through enhancing the environment to support the person with a life-limiting illness. And if anyone has any questions, we can go through them towards the end of the presentation. Okay, so occupational therapists support people with promoting health and well-being by enabling them to participate in their everyday activities. And within palliative care, we support to optimize what someone can do. So we promote their dignity, enhance their quality of life, and support safety and independence. I'll go into more detail on the OT's role within palliative care later on in the presentation. And this presentation will focus on the early stage of being diagnosed with a life-limiting illness. I'll go through some of the support which people may not have thought of to support someone that has been diagnosed with a life-limiting illness. And the whole aim of this presentation is to support them to live life to the fullest. Okay. So what is palliative care? Palliative care is care that enhances the quality of life of people diagnosed with a life-limiting illness. The term palliative care can cause feelings of dread and distress, and it is commonly misunderstood term that people often believe that they are going to die immediately, which is often not the case. And the aim of this presentation is to show that people can live life to the fullest, but just things might need to be modified and changed. Okay. So individuals experiencing this life stage transition may experience physical and psychological symptoms. Each person's experience is individual to them. So, for example, people may experience some physical symptoms such as fatigue, breathlessness, pain, changes to their mobility, nausea, vomiting, and changes in their weight. And I will go through later on in the presentation how the occupational therapist can support the person to lessen the impact of these symptoms. People can also experience psychological symptoms because it can be a stressful time for the person and their family as they begin to process their diagnosis and their future. So some of the psychological symptoms may present as feelings of helplessness, difficulty accepting help, changes to their concentration or memory, and an inability to cope. Fine. So how can we help? So we can help by maximizing a person's quality of life and enabling them to engage in meaningful activities despite their challenges of living with a life-limiting illness. We will support the person to identify the challenges that they are experiencing with their daily activities. So it may be that showering is becoming more difficult for the person, or preparing meals is a lot more challenging than it used to be. We will work with the person and their family to set suitable goals and implement strategies to support the person to work towards their goals and improve their quality of life. So some of the strategies or interventions that the occupational therapist might provide um, would be focusing on the person's symptoms and providing environmental supports, equipment prescription, and providing education on pressure care, how to manage fatigue to support the person to continue to engage in their meaningful occupations. So I'll go into each one of these in a bit more detail and provide some examples as well. So for modifying the home environment, the occupation will assess the home environment and work with the person and their family to establish what their difficulties, what they're finding challenging. So, for example, the person may have difficulty getting in and out of the shower, or they may feel very tired when they're showering. So, the occupational therapist can look at potentially installing a grab rail in the shower to make this safer and more accessible for the person. Also, the OT may suggest enhancing the environment and the home setup. For example, the OT may suggest moving a bed down into the living room, into the lounge area, and to allow the person to participate in family activities, such as meal times, but still allowing the person to get some rest. Assist, and then also the occupational therapist can complete an assessment and potentially prescribe some equipment. So we may suggest equipment to increase the person's participation in their meaningful activities. For example, we may recommend the person uses a wheelchair when they're out in the community to conserve their energy, and allow the person to have more time to socialize with their family. Um, we also might determine if there's any form of pressure care mattress or cushion that is required to prevent pressure injury, and provide education to the person and their family to prevent pressure injuries. And also kind of going back to in the shower, if the person is finding it difficult to stand up or they're quite tired when they're showering, things like a shower chair may be recommended to allow them to complete their showering and sitting, to conserve that energy so they're not using all of their energy to stand up in the shower to complete their showering. Okay, so then modifying activities. So this is a huge part of an occupational therapist role within palliative care. As I spoke a bit about before, people that have been diagnosed with a life-limiting illness, they experience a lot of fatigue, and that can be one of their main challenges is to try and lessen the impact of this fatigue. So in this case, the occupational therapist will uh, assess the person and also discuss with the person and their family members on how we can modify activities that they still really want to participate in, and how we can make those activities easier for them and that they don't have to use as much energy and they're not becoming really fatigued after they do it. So, for example, the occupational therapist might provide education to manage this fatigue, such as rearranging their activities so that the person is doing the most important activities first, or that they're building regular breaks into their day so that they're not doing everything at once, and then for the rest of the day they're completely wiped out and fatigued and they can't do anything else. We also might suggest breaking down activities into smaller tasks, and providing education on making tasks easier for the person. For example, instead of trying to complete a large task in one go, they'll break it down into smaller parts for the person. For example, instead of attempting to clean all of the kitchen, they focus on just cleaning the surfaces or washing the dishes, or um, as well. If they still enjoy cooking and they still want to participate in cooking instead of chopping up all the vegetables because they might get quite tired from that, using frozen vegetables where possible, if cooking is still important to them. And making sure that the person is completing tasks in sitting where possible. So, for example, if they still want to chop up their vegetables, they can do that by sitting at their kitchen table and chopping up vegetables, or for example, if they still want to they loved gardening and they still want to participate in some way in getting out into the garden, we can look at ways of trying to get the person out into the garden. Or if they like going out into the community to socialize with friends, we can look at ways to make this easier for the person, and allowing them to still socialize with their friends and still engage in their meaningful activities. Mm. So, implementing support. So some people living with a life-limiting illness, they may need help with their daily activities from a family member or for formal support. So the occupational therapist will work in conjunction with the funding provider to see if there's any formal supports that may be able to be put into place to help support the person at home. We also might provide education and training to family members and carers, such as different manual handling techniques and strategies, or providing equipment that would support with transfers and manual handling. Okay. And when to consider a referral to occupational therapy. So as discussed throughout the presentation, there's many ways in which an occupational therapist can support a person with a life-limiting illness. And the main aim is to focus on maximizing the person's quality of life and enabling them to engage in meaningful activities despite their challenges of living with a life-limiting illness. So if a person is experienced, as I've said before, if they're experiencing fatigue, which is impacting on their ability to complete their meaningful activities, they're at a high risk of developing pressure injuries, they're having difficulty with getting around their home or getting in and out of their home, if they're experiencing reduced ability to participate in their meaningful activities due to physical decline, all these types of challenges, the person would definitely benefit from occupational therapy input and a referral. Um, so also dietitians play a big role in palliative care, and they would work alongside the occupational therapist, as it is important that the person is has adequate food and has adequate nutrition to be able to engage in their activities and that they're not feeling really fatigued. So the dietitian can help with symptom management. They can help with symptoms such as nausea, vomiting, constipation, and loss of appetite by providing tailored dietary advice and support. They can also provide nutritional support, so assessing the person's nutritional needs and recommending appropriate oral, enteral or parenteral nutrition, and advise on food fortification and supplement. They can also provide advice on comfort, feeding, so prioritizing foods that are tolerable and enjoyable for the person, even if they don't meet all nutritional requirements. They can also provide education and support by educating the person and families about dietary changes and safe eating practices. And they can overall improve the person's quality of life, and make sure that they are comfortable and that they're enjoying their food in the later stages of their life. Fine. So just to conclude, so being diagnosed with a life-limiting illness can be daunting, and it is important to support the person to continue to engage in their meaningful occupations and activities through tailored interventions, and other supports and services. And as I spoke about at the start of the presentation, the occupational therapist may work in collaboration with other healthcare professionals that can support a person with a life-limiting illness. For example, a physiotherapist can support the person by providing techniques to support with exercise, manual therapy, and pain management strategies to reduce pain, fatigue, and breathlessness, which the person might be experiencing. And a speech pathologist plays a vital role as well in palliative care, focusing on optimizing communication and swallowing, feeding difficulties in individuals with a life-limiting illness. So that is the presentation. Thank you all for coming today. I think the next webinar is going to be on the 9th of October, and it's going to be with our podiatrist on insights for improved foot care. Yeah, and if does anyone have any questions, if you just want to raise your hand, and I can try and help you to answer them. Nicole, you're on mute.
Sorry. Thanks, Emma. It's a very difficult discussion to have, and yeah, it's very sensitive. And I know, yeah, dealing with families who are going through this as well, and to have your active symptom management is really beneficial. So, yeah, if anyone doesn't want to raise a hand, you can type questions into the chat as well. There is also another organization, and it's called Dying to Know You. And it's actually Dying to Know You Day tomorrow, and they have a lot of really good resources on their website as well. And it's how to have the conversations, all the paperwork and things that you need to have in place for end of life planning, and some beautiful, beautiful thought discussions and thought starters and things like that to have with people of all ages to discuss this topic. So I highly recommend you head over to that website. They've had a lot of graduates working on the project as well. So there's a lot of, young people putting their thoughts and creativity into the campaign as well. So yeah, they've made it a lot of fun out of a difficult topic. So yeah, thank you.
Thanks, Nicole.
Any questions? Well, everyone's got some more time in their day then. The best gift you can give. Thanks, Emma.
No worries. Thank you, everyone, for joining.